So you want to know about cannabinoids for chemotherapy. The evidence is certainly intriguing, but it was not nearly as robust and strong as I would have thought. Out of the dozens of studies in the last 10 years, I will cover 7 symptoms as well as the painful truth about cannabinoid interactions with chemo treatments. I'm Lex Pelger, a drug writer focused on cannabinoid science. Ask me anything. I'm sponsored by the Cannabis and Health Research Initiative out of Johns Hopkins, and they will pay you $100 to talk about your use of our favorite plant. Link in bio. You can also join their newsletter where twice a month I curate the best of clinical cannabinoid science. Let's start with this famous quote from Dr. Abrams and this review of 16 studies that found medical cannabis in cancer patients can increase survival times, improve mental health, sleep, appetite, pain, and cognitive function while decreasing nausea, vomiting, and the use of other medications such as opioids. So, for the nausea and vomiting from chemotherapy, the evidence was weaker than I expected. Here's 2 reviews covering 30 plus studies, and in this age of triple and quadruple antiemetics for nausea, the combination of THC and CBD usually work better than a placebo, but there is not much evidence for them against the current top nausea medications. Overall, they seem to be a good add-on to the usual treatment regimen. Relatedly, there is the chemotherapy effects of anorexia and cachexia, which is muscle wasting. For anorexia and older adults getting cancer treatment, this review of 6 studies found that 5 to 10 milligrams of THC could help people put on weight. Specifically, these interviews of people with cancer and their caregivers found that vaped cannabis caused benefits to eating and appetite stimulation. But, to be fair, this review of 10 studies found no help for weight gain, appetite stimulation, or a better quality of life. Who the cannabinoids might help may be quite individualistic. But now for the strongest evidence, neuropathic pain, which is nerve pain reacting to non-existent stimuli. With symptoms such as numbness, prickling, sharp jabbing pain, or throbbing burning pain, neuropathy is very difficult to treat and opioids often don't touch the pain. This study from last year found cannabis reduced symptoms and improved quality of life, with THC showing greater improvements for burning sensations and cold sensations, while the combination of CBD and THC yielded the greatest symptom relief. Speaking of CBD, this survey found that one of the main reasons for its use was for neuropathic pain. And in this study, they used 600 milligram doses of CBD before the chemo treatments to help prevent the development of neuropathy. And this study found that CBD combined well with exercise for improving hand grip strength, gait speed, manual dexterity, and perceived physical function. Another terrible symptom of chemo is mucositis, painful inflammation of the mucous membranes of the gums, mouth, and entire GI tract, which is especially common with radiation therapy. In cancer patients with pain from mucositis, cannabis oil lowered their pain intensity as well as improved their chewing, swallowing, speech, and quality of life. Intriguingly, this study found that both CBD alone as well as CBD combined with photobiomodulation, which is laser light therapy, lower the levels of mucositis. Next, AIMS. In women treating their breast cancer with aromatase inhibitors, they can develop a painful musculoskeletal syndrome of bone loss and joint pain. This new study found topical cannabis balm improved pain scores, and this study found that 100 milligrams of CBD help with that joint pain. Finally, 2 of the big ones, sleep and mood. This review looks at how people use cannabis for sleep disturbances and anxiety, and this study found that a lower ratio of THC to CBD was the best for helping anxiety and disturbed sleep. Also, a lot of our data comes from surveys. This survey across 12 cancer centers found the most commonly perceived benefits of cannabis to be pain, sleep, stress, anxiety, and for treatment side effects. And this is true for pediatric users of cannabis as well, and of course, CBD is also well known for helping with sleep and anxiety. But let's end with an honest warning. I have a whole file on how the effectiveness of cancer treatments are altered by the cannabinoids, and I'd say roughly half of them show no interaction, good or bad. 1/4 of them show cannabinoids helping the chemo treatments work better, and 1/4 of them show that cannabinoids lower the efficacy of the treatment. For all of my data on this, DM me, and as always, ask me anything.